age.
Oh, I know.
All right,
I
so I think we'll give it a few minutes for folks
no,
to.
I know.
This is usually
Yes.
one of those meetings where people kind of come in a couple
Okay.
minutes behind. So we'll just give it a couple minutes, and Sarah's actually gonna chair our meeting today. So I'm gonna, for now, go on mute. And unless Sarah, do you need me to do an open of any kind?
No, I think we're all set. I'm just going to make sure we're letting everyone into the from the waiting room and give our wonderful guest speakers co-host permissions,
Okay.
and we will be ready to party.
All right, that sounds good. I think y'all, if you just joined, we're gonna start at about 10:03 today.
No problem. I thought I saw David there.
I believe you did. Your eyes, I don't think your eyes deceived you, but he did disappear for a moment.
Okay. All right.
We're just going to give it one, maybe 2 more minutes for folks to join. Nice to see everyone's faces today. All right, it is 10:03 and we have 16 folks here. So let's go ahead and get this party started, even though if a few more trickle in, that's fine. This meeting is being recorded and we will be sure to send out the recording after in our newsletter. But good morning, everyone. Hello, my name is Sarah Starin. I use she, her pronouns if we haven't had the opportunity to meet. And I am joined by our Co-Thrive Executive Director. And I'm also now just seeing that my name still says CCRI. So, as a wonderful reminder to everyone, CCRI has recently rebranded to the name Co-Thrive. It's very exciting, and Kira and I are dangerously close to sharing a new website with you. But we have new logos and new emails, and we'll be sure to drop those in the chat if you haven't had a chance to reach out to us at our new cothrive.org emails yet. But I am really excited today to be joined by some really innovative minds and folks that are doing some really cool work in the social health information exchange space. I think a lot of what we've been talking about at the Co-Thrive level around integration between different sectors, state or community-based, national even, we're really going to need to rely on these SHE systems. And as Colorado is in the process of going through a lot of work, and I know Ojai is doing work, I know Karen's here, and that there's also a lot of work happening at the community level. So I'm really excited here today to introduce eTransX. eTransX provides, excuse me, lost my notes for a second, provides innovative technology solutions for healthcare and public health organizations. Their platform streamlines data management, improves patient outcomes, and fosters community collaboration to address complex health challenges. One product in particular is deeply aligned with Co-Thrive and our mission. Their Wellbeing Care Community is a comprehensive platform that's designed to unite governmental organizations, nonprofits, and other direct service organizations in a focused way to address both individual and communal needs using their healthcare and community technology solutions. This platform supports broader physical, social, and economic health concerns of a population and provides a centralized hub for collaboration and resource sharing. Today, we're joined by P. Mohan, founder and president of eTransX, their vice president, Richard Taylor, and software expert, Matt Grimes. P. Mohan has more than 35 years of experience in the field of information sharing, information systems, and engineering. He's one of the founders and president of eTransX since inception and is responsible for day-to-day operations, strategic directions, and growth. His technical and management experience spans all aspects of systems and application integration, information systems design, implementation, and project management for various commercial and industrial enterprises. He is the chief architect of eTransX products, including the innovative cross-sector platform we're going to be learning more about today. He has assisted many communities, hospitals, integrated delivery networks, accountable care organizations, software companies, and more with their information and integration needs to develop these new systems using the eTransX products. Richard Taylor, the vice president, is a strategist and advocate for improving well-being outcomes at a community level. For the past 11 years, Richard has served as vice president at eTransX, where he has focused on helping communities and regions implement new community-based initiatives to reduce poverty, reduce substance use disorders, improve health outcomes, and promote positive child and youth development. Richard serves on advisory councils for the Tennessee Cluster Economic Development Council and the Coalition for Better Futures for Southeast Nashville. Prior to his work at eTransX, Richard served as a consultant and advisor with state and local governments on using technology to improve well-being outcomes. I'll be sharing a few links in the chat to add some one-pagers that P. Mohan and Richard had already shared with us. And we're very excited to have these folks here to us. And also I want to give a shout out to David Aylward for bringing together this wonderful collaboration and connecting us after he put something in a chat at a webinar. And these folks were like, hey, that sounds like something we should be interested in. So I will turn it over now to our wonderful presenters.
Thank you, guys. Thank you, Sarah. I just want to say, David, thank you. You're the one who started it all. So I appreciate that, Kyra and Sarah, on this. As we were talking, we had a few discussions with Kyra and Sarah before, and the vision that they shared and David shared, and it was all kind of aligning so much with what we do on a day-to-day basis. We recognize technology is a part of it. That's not all of it. We understand that, when we try to help people, that's just a one of many things that has to happen. But the way we cannot be in the front line helping people, because that takes very different types of people with a commitment and passion like what you guys do. What we do, however, is to enable you guys to do better and bring the collaboration, make your life easy so that you can help more clients and patients. So that's the concept that we work under. And the whole point we looked at it is we don't want to look at anything as a transactional process between a client and a navigator or a person. It needs to be a transformation. That's the kind of approach we have taken. And you would see that both in our presentation and a short demo that we have. We definitely want to keep this very open. We want you guys to grill us. Absolutely grill us on anything, every problem that you have seen. I don't think you can do this. Throw at us and let us figure out whether we can answer that promptly and satisfactorily to you. Okay. With that, I'm going to hand it over to Richard. Richard is going to do the short presentation. Then we'll do the demo. Matt will do the demo. Okay. Are we all good? All right. Go ahead, Richard.
Yeah. Thanks, Sarah, for the introduction. And certainly we've been in this business in healthcare for 25 years. And we think what's going on in Colorado is one of the most exciting things we've seen in a while in terms of the Co-Thrive initiative, as well as the SHIA initiative, because we feel like you all are you're leading edge on making the model work for helping people have better health outcomes and at the same time have better health care. And so we're excited to be here today to share how we've been involved in this effort to help improve well-being and health outcomes. And so as Mo had shared, we're going to just spend maybe 10-15 minutes on doing a short slide presentation, and then we'll go into the demo. And please ask questions or put questions in the chat as we go through this. We'd be glad to get your feedback as we go, rather than wait till the end to do that. So I am going to share my screen here. And all right. First, again, we think Co-Thrive is right on in terms of where you're focused in terms of improving an individual's health and wellness by integrating all the different systems that have to be in place to help in that journey. And we also love your concepts, the commons. How do you engage the community-based organizations? How do you work directly with the individuals? And we love the fact that you put the individual and the family at the center of your model, and then you engage with the companions, which are those that are helping those individuals in that journey. And this is, so right on in terms of how we have been putting together this wellbeing care community system. How do we engage all three of these groups at the same time? And the other thing that we think is very appropriate is you do this on a regional basis. It's not a statewide one size fits all. It's not even the single county commission or county community. It's working together as a region. And so we like the model of how can you do that? And we love the leadership that the Ojai group is providing in that space. And when we look at the Ojai model, again, they have the individual at the center. It's person focused, and then you're bringing in the social side, the physical health side, and the behavioral health side. How do you integrate and communicate across all three of those groups? And they even the challenges that they've said that they want to address are the same challenges that we've seen working in four different states. We find these same challenges, that data systems are siloed, that the social determinants of health, which are 80% of the impact of a person's health, are not as addressed as they should be, and that social care is so important as to how you engage and bring in friends and family as part of that social capital that is so needed. So again, Colorado is doing wonderful things. and so we took what you learned and put it in the form of a system that we call the Wellbeing Care Community System, which we believe is the first of its kind. How do you make a person-centric system work across different sectors and different community-based organizations in terms of coordination? And we're leveraging 25 years of experience. We got our start in healthcare, connecting hospitals, labs, and doctors' offices, sharing clinical data. And we still do that today in 20 states. And so we've now focused on this next level, which is the Wellbeing Care Community that we'll be presenting today.
Richard, sorry to interrupt, but there's just there's some gray screen or gray boxes on top of your slides. Is it possible for you to move those over? I think it just might be something from a screen sharing.
I'm going to stop sharing and reshare, okay?
Okay, great. Thank you. Sometimes if I have the chat window up for Zoom over it, we're still seeing those.
Still seeing
they are getting worse, actually. What are those?
Okay, all right, let me try again here.
And I'm happy to, of course, monitor the chat for you, so don't feel like you need to keep that up.
Okay, good.
Okay.
Close the chat, Richard. Is that the one? No?
No. Is it still there?
That made it smaller, but we still have a large one on the right side.
Click on that, Richard. See where that changes anything. Is that a window?
Okay, yeah, I see what you're saying.
Yeah, can you share instead of a screen just the window?
No, did that take care of it?
Oh, that took care of it.
Perfect.
What's that? There's one more there. Two of those pieces.
I think we can see the whole slides now, though. So if that's the best
Okay,
go for it.
Go for it.
Right.
Go for it.
Okay.
Thank you.
All right. Anyway, Siren is another group that we follow. They are a nonprofit group out of the University of San Francisco that's been evaluating how technology is used to address the social determinants of health. And this is how we met David Howard is attending their most recent presentation related to a new report that said that referral management alone is not enough. And this is the comment that David made on that webinar presentation that just attracted our attention. It says he is so right that this is the people that are being served require that trust relationship as well as working with them for the long term, not just the short term. And that's what we love about the Co-Thrive model, is that has been your focus. So these are the same operational challenges that was identified by Ojai, as well as we've identified over the years that we wanted to address with the Wellbeing Care Community System. And so I'm just going to give you a quick overview of how it works, and then we'll go into the demo itself. But as Mohan shared earlier, what we saw when we looked at the communities that were using systems, there were case management systems, there were electronic medical record systems, there were referral management systems, there were client communication systems, setting up appointments and reminders. But these are all transactional related systems. And so what we have designed is a system that's focused on a person's life goals, a life management approach that's focused on building success pathways, that's focused on measuring outcomes and not just activities, and a system that engages not just the community-based organizations, but also the personal support networks of people that are trying to improve their lives in the community. And so this is what's different about our approach and our in terms of designing the Wellbeing Care Community system, is that it's designed to be a transformational focus instead of a transactional focus. And it's focused on outcomes, not just activities. So we do this by connecting at the personal level as well as connecting at the community level at the same time concurrently. And at the personal level, we're identifying households that are not thriving. We're using our system to collect additional information about those households. We're matching those households with appropriate mentors, navigators, coaches to build success pathways that are then used to drive community referrals, and that is used to track progress in terms of how is that family or individual progressing on that journey. And the way we work is we identify an anchor organization that is in the community that is our customer. They're the ones that already have the relationships with the other community-based organizations, and that's how we deploy the system. And when I'm talking about these pathways, we're talking about a whole person approach. So it's not just health concerns, it's not just wealth concerns, and it's not just relationship concerns. It's any of the above that's part of that success pathway that is being built and managed for helping individuals have a better life and well-being outcomes. And at the community level, what we're doing is we're connecting all those different silos. How do we share information between the different organizations that are helping these same families? And again, you can have 3, 4, 5 different organizations working with the same family, but they're not talking to each other, and the left hand doesn't know what the right hand is doing. And then the third thing that we do is to keep up with the latest best practices. These are examples of some national organizations that we keep up with, saying what are the best practices for helping communities work together to improve well-being outcomes. And you have one right there in Colorado, the Aspen Institute, which is a wonderful group that we've been following, for years as to ideas on how to do these kind of things. So to sort of summarize, what we're doing is providing a community-based, regional-based platform that connects people at the personal level, as well as connecting organizations at the community level to work together to help families and individuals improve their life outcomes. So there's 4 groups of users of our system. There's the clients themselves, individuals and families. There's the community-based organization staff members. There's the navigators, the mentors, the community health workers, and then there's the friends and family of the clients, all using our system to communicate and share data. And this includes built-in privacy consent management to manage who can see what information. This includes compliance with HIPAA and 42 CFR. We even have a crisis alert button that we can activate, as well as the ability to enter data once in our system and then feed other systems. So I'm going to stop here. That's a lot just to sort of cover in terms of any questions that you might have.
There are none in the chat, so
Okay.
if
All
no
right. Well,
speak now or
again,
forever hold your peace, y'all.
yeah, I just wanted to pause.
I do have a question, Richard.
Okay.
Yes.
Hi, this is Karen Shimamoto. I'm the Deputy Director at the Office of eHealth Innovation, and we're
Oh,
also
great.
trying to put together the SHE.
Mhm.
And so just curious about what your consent model looks like and your consent management process looks like, because it's such a huge undertaking. And you're also requiring different organizations to be able to use one workflow or, just kind of curious how you got around that piece.
So let me take that one right there. Karen, we have multiple levels of what shall I say, access permission on this. We're starting with the organization itself. As more organizations are going to be working together, so there is a shared org concept over there. So that's the first step on that. And then we go into the role model. So these are all kind of the consent process basically says, do I have an implicit or explicit access this information? Then who can access is the way we kind of approach it, those three models there. The org level, role level, then actually individual client level, and the fourth one will be what we call as object level. A 4 level of access permission for people to access any appropriate information there. So depending on, you can revoke and accept and all those things there. But consent is given when they say, yes, they can see this information, whether physical, behavioral, or social. They can kind of go with that approach. Then they can go into any specific. Let us say you are filling out a substance use assessment there. You can go to that level. That assessment, I do not want anybody else to see except my person, the peer recovery specialist that I'm working with. And that's across the multiple groups and organizations that work with that client. So that's the kind of level of this. So consent is given. Yes, I can, I have given consent for you to share some information, not share this, all that. They will work with the navigators and the anchor organization to set those things up. Does that answer your question, Karen?
Yeah, it does. It does. I guess to kind of, and I know you'll probably get into it later too, but kind of, looking at that granular consent, is it happening on paper or through the EMR, or is someone inputting that data?
Yes, it is the part of working with, it's all electronic, no paper. We do get a paper consent as with the signature and all those. From there, you have a very generic approach. At least the communities that we have worked with, they have created this consent management. They will identify, here are the groups that I'm going to work with. Here is some more information we'll share with it. We have your consent to share it. They'll say, yes, we have a hard copy, electronic copy of it in the system. Then goes into electronically, they enable and disable kind of things for the part of the configuration process that the team works with clients to do that. So it's a combination of both, Karen.
And this is modeled after the San Diego Community Information Exchange, where you have data sharing agreements with all the participating organizations as part of this.
Yes. Good question, Karen. Any other questions? And some of this, Karen, Matt will kind of show you how that's done and all that stuff, so you'll be able to see it as well.
If I could ask you a question, Pete.
Sure.
And it's good to see you again. I like your hairstyle.
Of course.
Most of the people you're dealing with have their own data systems. Most of the CBOs, or many of them, have their own data systems, and certainly the medical people have their own.
Yes.
And so the technical layer of interoperability is one thing. The semantic layer is a whole different thing. How are you dealing, and people around the country have focused on, well, let's get agreement on these fields or this set of name, address, the kinds of things we know everybody needs, and let's agree that everybody will use this terminology for that. How are you addressing semantic interoperability?
So, as Richard pointed out, 25 years we have been doing this. Our bread and butter technology is integration, data integration. We have an engine called HEMI, Health Enterprise Messaging and Integration Engine, just been there in hospitals and all those. That was one of the major issues that we had to address long back. So we have all the technology to address both the transportation layer as well as semantic layer. When something comes from Epic in one way, how do you address all the other things in a different way? So how do you kind of go through it? So we have tools that will map those things out and appropriately. When it comes here, it'll come this way. When it goes to them, it'll go in a very different way of doing that. And that is one aspect of it. Then this X runner, which will pretty much simulates a user it automatically logs in just like a user will do from one system to the other, and it will do the same thing. It will get the data into one, convert into the semantically what it means into others, then it'll go ahead and update that. So it is a common problem on all the integration, but that's it takes effort, but it is how we do that all the time. But we have enough tools and technologies to make that happen.
Thank you.
Yeah, good questions. So essentially, what we call a community well-being management system, it's more than case management, it's more than referral management, it's more than activity tracking, it's more than customer relationship management. It's all of those kind of functions built into a shared community platform that somewhat operates as a community information exchange that involves both the health and the social. But at the same time, we will interface with those existing systems that's in a community so that we are coexisting with existing systems. Essentially, we have built in the care coordination component, the referral management. We can do that internally. Our interface with local or regional or statewide referral management systems. And then we're providing that functionality, as Mohan shared, about how do we move data between those different systems. And then we're engaging directly with the clients. They have their own phone apps that they are engaging in, providing information and sharing information. And then we're connecting with their friends and family as part of this comprehensive kind of connection, so that we're helping this as a team effort between multiple organizations and multiple people working together. The other concept is that some of your smaller community-based organizations, they may not have their own system. They may have spreadsheets. And so we allow for the anchor organization to set up a node on our system to allow an individual CBO to use the system as an internal system to manage their particular clients and yet be part of the larger regional or community-based solution as well.
This is a very important aspect, Karen, as you perhaps are fighting this issue just about everywhere. You know, a lot of the organizations, as you mentioned, Excel and sticky notes. That's how their whole operation goes. But they are very, very critical in the health. They perhaps offer the health service, homelessness services or food services. So how do we engage them in order to do that? That has been quite a challenge for a lot of the groups. So what we are approaching is, yes, you don't have it. What if I can give you some tools that will help you better than Excel, better than sticky notes, but it'll also help us as overall in the network, bringing everybody together. I will give you, so what you do, nobody else will see. It's yours, your clients, you do what you need to do. You have all the tools that big groups has it. But at the same time, you can get the referrals, you can engage with them, communicate in a comment. So that approach has been very positive, but it's still work. It's work in progress. People don't change that quickly, but we have to work it. But what we have given is this. So what this allows is hub and spoke model, and anchor and hubs. You can have a multiple hubs, meaning you can have a housing hub, transportation hub, you can have a food hub. Within that, you can have all of them can be in the same community. So it's a lot of flexibility this offers. This is the way we see, again, by region. You can have a different region with entirely different configuration for them. And each region can, again, hub of hubs, they can also communicate. So from Karen, your perspective, from the state level, multiple regions, individual hubs, mini hubs, you can think of they're almost like a spider web going all across, is the way that we think about. Does it make sense?
We do
Go
have
ahead,
one
Sarah.
question in the chat from Faith.
Okay.
It's regarding the family and friends communication. Is there a group chat function that is HIPAA compliant?
Yes. Well, we have right now regular chat on this. There is one, what we call as community chat. That is something we have not enabled it yet. That is something coming up. We are going to be, bringing that community chat, which is group chat, HIPAA compliant, and 42 CFR, all of them there that you can do that within that. You can set up your own. It's almost like think of your teams, but on the system itself there. But currently we do have ability to do an SMS regular connections. No, you don't have to share anything, but you can still talk about that. But we can definitely, we should be getting that community chat very soon on that, where that will be totally focused within our community. It's a good question. Okay,
So,
go ahead.
yeah, so just to recap, so we can go on into the demo, is that the benefits to the community is that the families that are being served, they don't have to tell their story multiple times. They have a personalized success pathway based on their strengths and their individual dreams. They have a connected support team. They have facilitated access to educational materials as well as access to other programs that they can see themselves with their phone app. And then you have the serving organizations that are able to share data between each other to minimize duplication of entry as well as minimize data silos. So those are the benefits. And again, Co-Thrive, I know you all have seen what can happen when you pull all this together. And also, we just love the Co-Thrive model. It fits what we believe is the way to help improve health outcomes. And we love the regional concept as well of OHI. So that is just wanted you to have an overview before we go into the demo here. And then you'll see, again, we're just going to do a short demo. We normally do an hour demo, but we're just going to do a short just to give you a flavor of how the system works. And we'll be glad to take questions as Matt does the demo here. And one last thing, this is a cloud-based system, so you don't have to download any software to individual computers. It's all cloud-based.
And what you'd see, the system really is an entire ecosystem for all the stakeholders, whether they are clients, whether they are navigators, whether they are CBOs, bringing them all together, working together. So if you can think of a collective impact system, if you can think of in those terminology. Go ahead, Matt. Matt, you are muted. Matt, you are muted still, I think. Matt, you are on the mute. Can you unmute it? Sorry, guys. Looks like he's
There we
there
go.
you go.
There we
Sorry, I
go.
was muted in
Yeah,
one
I
other
think-
place. I couldn't find the
Okay,
couldn't
all
find the
right,
other
Matt.
mute button. There we
Go
go.
for it.
All right, excellent. Can everybody see my screen?
Yes.
Yes.
Yes. Excellent. Are we having any of the strange
No,
boxes that were
we are
showing
not. We are
before?
not seeing
Okay.
that. Yeah, we are good.
Perfect, perfect. All right, so we'll be taking a look from three different perspectives briefly here today again. So the first perspective will be that of Joe Wilson. So this is somebody who's going to be in that care coordinator, that success navigator, that recovery specialist role, someone who's working day to day with these clients and their families, who's kind of, boots on the ground with them every day. We can also briefly take a look from the client's perspective, see how they would engage with the mobile app, and then also from the side of that CBO, that community-based organization who's helping provide those wraparound services. So we'll go ahead and get started here with Mr. Wilson. So when he first signs in, again, as Richard said, it is a cloud-based system, so we don't have to deal with any sort of installation or anything like that, but we're also a role-based system. So again, Joe has that role of care coordinator, and that's going to control what level of access he's going to have to client data, right? Because he's working more specifically and directly with these people, he's going to have more access than somebody who's working at, say, your local food bank, who won't need full access to medical history or something like that, just to be able to provide some of that food, right? So that's another way that we're controlling some of the access here for each client. All right, well, when he first signs in, the first thing he will see is his client panel. So this is any client that he is working with on a day-to-day basis. And our test client today will be Grace Watts. So we'll go ahead and move into her profile. So just to orient you guys here to her profile, kind of front and center here in the middle is going to be anything that we're working with Grace on. So you can see that we're dealing with her with some opioid treatment as well as poverty issues, right? We can kind of take a multifaceted approach to a lot of these issues with this system here. So that's kind of front and center. On the right-hand side, we have our client engagement panel. And this is where we're going to be able to make contact and engage not only with Grace herself, but with any other member of her support team. Right, so not only do I have emails and cell phone numbers, but we've also got all of the people on her support team. Maybe that's her physician, another care coordinator, maybe it's a housing provider or her mother, right? So depending on who is involved in the support for this particular client, we can bring those people in and deal with engagement with them right from here. So The other great thing about this is that we can do direct text messages from the system, right? We found that this is really one of the best ways to get client engagement. Not everybody has easy access to a smartphone or quick access to email, but most every client has a way to receive, say, a text message, right? So this is a really large driving factor for client engagement. And the great thing is everything that's done via the system, via the texting from here, is stored in the system, right? You're not having to go to each of your different care coordinators and look at their cell phones and go, hey, show me what you guys messaged Grace last week. No, it's all stored and tracked right here. So we've got a couple of options for texting. We can do either a static SMS where the user just types out their message, or we can work with your team to build out some standardized templates, right? Maybe there's some communication that you do very regularly with the client, and we can just go ahead and hard code that in as a template here, right? So we've got some there for all the COVID ones here. Maybe we want to do like a program check-in message for her, right? We can pick that. We'll do a preview of it. And this will actually go ahead and pull data from the client's record, right? It gets her first name, and it tells you, who is signing that message here, right? So again, all of that can be built out on an implementation level. So we'll go ahead and send that. Now, again, normally I would wait for Grace to text us back here today, but we do want to move this one kind of quickly on through the demo. But do know that any reply that Grace sends will come directly back into this screen right here, and your users will be able to see that, access it, work with it, all of that.
Quick question, Matt. Does the text message go to the app message or straight to the client phone?
Oh, it'll go
To the
directly to
phone.
their cell phone number.
Okay, thank
Directly
you.
to the phone. Yeah. Good question there. Again, in addition to that, I just want to add that you can also do the telehealth for any on the health side. We do that. You can actually set up the thing just like what we're doing. They can be doing it as well. And it's sometimes helpful on the substance use side where you really want to see them, how they are, based on them, you will know, even if they don't tell you the truth, you will figure it out. So there are good places, use cases where you can do that as well.
Yep, exactly.
Go.
All right. So generally speaking, most of our clients, when they get a new person into their program or their department, usually there's some sort of intake process that happens, and that most often starts with an assessment. So let me go ahead and move into that workspace, and we can kind of talk about what those are, how we create them, what they look like. So assessments are going to be one of our primary data capture tools within the system, and the system is going to come with a large library of these built in, industry standard ones, right? PHQ-9s, depression screenings, ACE assessments for child and youth, that type of stuff. So the one that we can look at today here is going to be the Prepare, and let me actually just show you that library briefly here. Get some of these. So again, you can see we've got a large number of these already in the system, but if there's anything that your team uses that isn't already in our library, we can absolutely work with you guys to bring that in and enable that for your users so that they can do their current processes within our system, right?
And likewise,
So
if
we'll
an
start
assessment
today.
is done at an ER facility, like a social terms of health assessment, that information from that participating community-based organization can also be captured and brought into the record as well, so that they don't have to take 3 and 4 different assessments for each organization they're working with.
Exactly. Yeah. One of the most common implementation tasks that we do is try to standardize some of that process across those organizations, right? Because usually if one organization is going to need some of that info for the client, the other community-based agencies may need similar info, right? So we're just going to work with everybody in a group to say, hey, let's unify this process so that it's standardized across the board for all of your clients. So just to very briefly take a look at this Prepare assessment. Again, this is more focused on social determinants of health. And so we'll just go through each of the sections here, right? So there's some personal characteristics. And this will give you an example of how many different types of data capture options we have, right? We can do yes, no, multiple choice. I can do multi-select lists. We can do short answers. So all of this type of stuff is available for us to create and use to capture the data for your clients. Yeah, I won't make you guys read the whole thing. This is kind of a long one, but that's, again, just to give you kind of some flavor of what that assessment might look like. And then the other piece is that while they don't have to be, assessments can be scored, right? So let's take a look at, say, this recovery capital index here. This one's a little bit more focused on Grace's recovery, her opioid issues, but it's a really good example of what a scoring matrix might look like. So we can set this up and for any individual assessment that says, hey, for all of these various different sections, these are the scores that each of the questions have. These are the weights that they're associated with. And then when the user completes this, we'll go ahead and tabulate all those scores. Like, for example, in this one, the answers that Grace answered to the assessment scored her at a 22, which puts her in the normal range of a 20 to 40. And when she's in that range, these are the next step for your users, right? We know we want to go ahead and get her enrolled in that medium intensity recovery program and then conduct some additional assessments. Right. So this is also something that we can work with your team to help flesh out, right? You know, if you do have certain scoring rubrics that go with your assessments and then, you know, standardized practices that follow after a certain score is met, we can bake those into the system so your users don't even necessarily have to think about that process, right? As they do the assessment, it's scored naturally, and then it just tells you right here, hey, here's your next steps, right? Excellent.
Matt,
Any
Matt, can I
questions
ask
on the
you-
assessments or scoring?
Yeah, Matt, if I could ask you, most of these assessments are medically centered and illness-based, whether it's social illness or a medical illness, and it's kind of the opposite of what you presented at the beginning. And I recognize there are people, some of them are required to use Prepare by federal regulation and others. But do you have, and maybe share with us, a strengths-based building a long-term relationship with somebody kind of questionnaire?
Self-sufficiency may be a good one.
Self-sufficiency, yeah,
Open
right.
that.
Open that one.
Yeah, let me pull that one
Yeah,
up here real quick.
and by the way, we allow you to develop your own assessments too, so that you don't have to have us to do this for you. We allow you to have that opportunity to build your own assessments and to score your own assessments.
So this one is more on all about what can I do? What do I have? Assessing on every aspect of your life. This is the social side we talked about there. Your healthcare is a component of it, but that's not all of it. As you can see, mobility, community, parenting skill. These are the stuff, you know, social determinants of health, usually they call it. So we can ask any of these questions, David. And this is just a starting point. I mean, all we give is, we have a lot of standard ones. If there are things that you want to do, build on your own, fine. We'll work with you. That's why a lot of the researchers group to come up with something, and we work with them to build these appropriate assessments.
Yeah, this one, I want a better life for my kids. These are the goals I have for my kids. We capture that, and then what pathways do we need to develop to help them make sure their kids do well in school and make sure their kids have an opportunity to go to college. These are examples of non-medical things that we can do with the system.
Yeah, that's what I was looking for. Thank you.
Yeah.
Then we have another question in
Cool.
the chat. How does the assessments work for billing and reimbursement? Insurance often requires an intake for billing and reimbursement.
No, the billing, and I'd say entirely another aspect of it there. We normally don't do billing right from the system. However, we can create the billing file, so to speak, for the EMRs or the other groups that send out the bills there. It's in the long, roadmap to add the billing itself directly. In some cases, they get paid, some cases they don't. So we have it in the roadmap, but we don't have it today. So if, for example, if you know that if you fill out the Prepare, there is charges that you can assign a ICD-10 code or whatever it is you want to do, we can work with you. And as soon as that gets prepared, you'll get a list of, here are the 10 patients or 10 clients you have filled the Prepare, so you can charge them for it. We can create a report and file and send it to you. So that's how we do it.
Yeah, we have a tracker, Matt, if you'll show the little icon where we're tracking the actual time spent with this particular client is being tracked and logged as they work with that client. And so that information is then captured to be used for billing purposes, saying, hey, this navigator worked with this client for this amount of time, and this is what can be billed to the health plan or to the other billing provider organizations.
So I think the
As a
point
slightly
on
better
that is,
example of that, let me.
Yeah, go ahead.
I was going to pull up the care activities here. Now, this took a second to load because this is our demo client. We do a lot of care activities for her. But as Richard mentioned, this is the time that we spend per client broken down workspace by workspace, right? So we can see, hey, look, here we modified that self-sufficiency matrix. Then we reviewed another assessment. Here we're reviewing the patient hub. Here's some assessments that we may have removed for some reason, right? So all of those activities and the amount of time that was spent is tracked here. And we can pull out from this anything that would be relevant for billing for your reports and create a report for you, right? Maybe you only care about this self-sufficiency matrix. Maybe that's something that is a billable event, right? Well, that's very easy. We can come in here and pull a report that says, hey, show me every client that's had this particular assessment done, how long we spent with them on that, and then tabulate that for you into a report.
if it is time-based. If it is not, it is basically unit-based, which is you finish the thing, you get paid. So that's a difference. So however, those kind of things, the implementation and team, Matt will usually work with you to get those set up.
Yeah,
Okay.
let's
Go ahead.
move
Go
along,
on.
Matt, because I know we have a limited time here. Cheryl had a question about, can we pull data on social terms of health from HIEs and other places? Yes, we can do
Yes.
that.
Absolutely. Absolutely.
Absolutely.
Go ahead. Go into
Perfect.
pathways.
Excellent. Yeah. So generally speaking, once that initial intake is done, that's going to help guide our user, right? Our care coordinator, our navigator, to help work with this particular person on a pathway of, success here for a particular issue, right? So under our pathways workspace here, we can see the two concerns that we're primarily working on with Grace. And right now, poverty does not have a pathway assigned. So we'll go ahead and assign that today. Now, what's going to come with that pathway is going to be a template-based approach that comes with goals and metrics and interventions related to this particular concern, right? And this is also something that we can work with your team to customize, right? If you guys have a set of standardized practices that you do when somebody comes to you with a particular issue, we can go ahead and create that with these templates here. But the ones that we do have already kind of built into the system are, as we were saying, it's best practices, right? What do we know from an industry perspective that says this is generally speaking the stuff that needs to happen when somebody comes with maybe an opioid issue or poverty, right? So that's where our starting place is. But again, we can customize all of that for your team as we work to build this out for you. So let me go ahead and assign a particular template here. And we can even do multiple templates per issue, right? So maybe there's a particular program that she's in that has its own template, or maybe we have a more generic template for her, someone who's not qualified for that particular program, right? So we'll go ahead.
An example of
and
that is we would have a pathway for somebody that's been in prison for 10 years that's coming out. That's a different pathway than somebody that just lost their job, that's a single mom and has 3 kids. So we have different pathways based on best practices that can be put in here to choose from.
Yep, absolutely. And now that I've got that pathway assigned, what that's going to come with is the set of goals and metrics that we're using for that particular issue. So here's all the new ones that got added for poverty. And these are kind of our big picture items for how we're going to get this person through this particular concern. And then how we deal with each of those goals, the small steps, will be our interventions, right? So these are kind of the individual steps that we'll need to do to achieve all of those various goals. And again, it's broken up by concern. Here's some opioid stuff. Here's some poverty ones. We've got target dates and priority levels and who's responsible. Is it the care coordinator? Is it the physician? Is it the client themselves? And so that's where all of this is set up. Now, the other thing about it is it's template-based, where we can, this is, brought in by default. But if we do need to add anything custom for this particular person, either at the goal level or the intervention level, we can always just add that kind of manually here for that individual, right? So say, hey, Grace here has a specific need that's not part of this template. Well, no problem. We can very easily add a new goal or intervention to capture whatever that is.
So if you can think of this as a blueprint for their success, this is what we talked about, the life management. It's not about just one thing there. This could be anything and everything there. It could be concern about, say, I have a problem. I need to attend my daughter's graduation. That's a problem. What can it could be as simple as that. It is okay. Anything that you can put there, anything to for their success. That's how we look at this.
Yeah, and we identify the barriers. Like say, I want to take this higher paying job to get out of poverty, but if I take that job, I'm going to lose my SNAP program, or I'll lose my housing voucher. So we have to be able to put, what are we going to do about that barrier as part of the solution? And so that's what goes, and that's the kind of complexities that we can support with a system like this that you may not have in other typical systems, is how do we deal with those barriers and what's the pathway for addressing those barriers?
Show them the view
Exactly.
option, let them see the whole.
Mm-hmm. And so the view here will pull everything together into a kind of a PDF, if you will. So this is something that can be shared out to maybe other providers if they need to see that. And again, it's just kind of a nice friendly way for us to view everything related to this particular person, right? We can filter this to be just a particular concern if that's something that this team is only focused on. Maybe we're specifically the poverty team here today, and we don't want to focus too much on the opioid stuff. Well, I can filter this list down to be just that stuff. But again, this is a nice graphical view of all of the concerns, all the goals and metrics, their appropriate target dates, any interventions, what's undone, what the status is, what the target dates are. All of that's displayed in a nice, friendly, easy to read manner.
We have a couple of questions in the chat. since there's a lot of different users using the same system, what types of training and orientation do you provide to make sure that we all use the same system correctly?
Yeah, I think the training is definitely a very important part of it. And even though what you see, we have a concept called the workflows. So what they do is, even though Matt has shown you all kinds of workspaces, you really don't even need to deal with all of those. It'll be a one simple workflow that you train on it that will kind of walk them through one at a time. And if you want to open one of them so they can see that, so here is my what is they have to do, here's my step 1, step 2, step 3. So many times what we tell them is just deal with this workflows. Everything you need to do a job, you can pretty much stay on this one place. So your training process is very simpler. You don't need to have a jump here, jump there. You don't need to do that. Even though what we have, the workspaces we show you because the demo system, but typically when you go into this, you will only see 2 or 3 items, not everything you see. So it'll be very simple, not too many things for them to get afraid of. So we simplify this process. We also have a training learning center. We have a lot of videos that we kind of do. Typically, we do the train the trainer approach. We train the trainers within the organization, and we have usually a system level person who understands the technical aspects of it. So those are levels we initially do. Then we also have a group training for the navigators and users. We typically do that as a one person. So if you can, everybody can help their own organization. And plus 24/7 access to the learning center. They have it. They have a videos, how to videos. So you can look through that. So those are the ways we help them train.
Yeah, and we have a help button on the screens. If you can't remember how to fill out a form, you hit the little help button and it'll drop down and give you instructions on how to do it.
So, okay.
Thank you. And then one more question. Is there a calculation for the client to know at what income level that they will lose services, like the SNAP example?
So
Yeah,
that is a part of usually kind of the assessments and dashboards we can create. They can actually do, we have certain things for some people, they can change the number. For example, we have integrated this with Federal Reserve Atlanta for cliff effect. So if they fill out a form, I'm trying to look for a job with $50,000 per year job. Now I'm only on 20. What will happen to my they put in certain information that actually goes to Federal Reserve, runs the calculator, brings the data and shows them and say, oh, by the way, you're going to lose SNAP, you're going to lose this. So that process is already built in with our system. Okay, good. Go ahead. Keep going, Matt. Go to the enroll programs and search through the referrals. Keep going.
Yeah, perfect. Yeah, we'll go ahead and move into referrals here because that's going to be a way to tie in that CBO, that community-based organization there. So this is how we're going to be engaging with those agencies in the community who are helping to provide wraparound services for the client, right? So what we'll do here today is go ahead and make a new referral for Grace for whatever that particular need is. So I will pick first my agencies from the list. These are going to be a list of our preferred agencies, so people that we work with on a day-to-day basis. Again, SOS Assistance is going to be our demo agency here today. And then now that I've got that agency selected, a list of their specific services is now going to pop up under this service list. So we can see, hey, maybe we want to refer her for some subsidized housing, right? And we'll mark that as a new referral as of today. And we can even put a note in here, and this is a good way for us as a navigator or care coordinator to communicate with the person at that agency here.
And this can be
I'll
used
go ahead and save this.
Right. Let's say you want to enroll your child in a Boys and Girls Club. That would be a referral that says, hey, I'd like to enroll my daughter in the club. And so that would go to the Boys and Girls Club, and then they can respond in the system as to, yes, we have openings, and this is what you need to do next. Those are the kind of dialogue that we're talking about here between the different organizations.
So the way we do this, I think, Karen, this may be not everybody has to have the system. Of course, ideally, you'll have a lot more features with this. But if not, even a simple email you can send, we'll give you a common email box. It automatically route it, and we have an intelligent email processor that will bring all that information as well. So we can do that as well. So go ahead and go to the CBO directory. Let's show that, Matt.
Yeah, absolutely.
CBO place. Yeah.
You want the directory, or do you want me to pop in?
Yeah, no, sorry. Go to the CBO portal.
Perfect.
Yeah.
All right, so this is us logging in as Miss Banks. She's going to be a user at that community-based organization who's going to log in to respond to and deal with that particular referral, right? So she's going to have a similar view to what Joe Wilson has when he signs in, but these are going to be any clients that have been referred to her particular organization, right? So usually what we'll do is once that referral is, created, we'll create an alert for this person or, a designated user or designated set of users at the organization, and that will let them know, hey, you need to sign in because you've got a new order available for you guys, right? So she will start from this current orders workspace. And here right at the top, we can see our order for subsidized housing for Grace. And we'll go ahead and click on the order number here to engage with this, right? So from here, this is a good way for us to keep that loop closed, right? We're not just kind of firing this referral off into the void and crossing our fingers and hoping that something happens here. This is how we know that something is getting done because of that referral, right? So Ms. Banks will come in, she'll change the status of this, hey, we do have room for Grace in this ongoing housing program. So I'll update that status. And then we can even post a note back to the coordinator to let Joe Wilson know, yeah, we've got room for Grace in this program and we'd be happy to get her some housing, right? So now again, all of that is tracked and communicated within the system. And then if there were any other things that came with that particular referral, if a document has been uploaded, maybe there's an ROI that needs to go across, maybe there's a particular appointment that needs to get scheduled. Again, all of that would show here. And again, this is just a really good way for that agency to be able to engage with the referral directly and keep that loop closed.
Yeah.
So,
and this is where, as we talked about, these CBOs do have, this is one of the things, if they are sticky notes and Excel sheet, this is where you can give. They can pretty much do all those things. They have all the action. They can add a patient or a client in the task assessment. They can refer to another social group, just about the chain, the spider web I was telling you about. So they can kind of refer to somebody else, they can refer to somebody else. So you have still record of the same client across the entire continuum of care. So that's what this does. So it's a very powerful way of bringing people together.
Yeah. Well, there are 3 questions in the chat that I want to address. One is viewing the data from a family group perspective. We do treat each individual in the family as a unit so that we can do individual tracking of individual family members or household members as well, and then see that as a group as opposed to an individual. So we can view this from a family or household group perspective. And then is there another portal for providers to log into, or will this be integrated into their EMRs?
The SSO, I think, Karen, I saw your thing there. Yeah, we can do the SSO. It already does that. And in addition to that, if they don't want to do that, if somebody else, kind of give the data, well, whatever data here, we can bring it back to them. So if that's what their EMR system allows. So we do integration with just about anything, Epic, Cerner, Athena, NextGen, you name it, we can do all of that as well.
And yes, we do connect with EHR systems directly or through the XRunner, or we can connect with your local HIE or regional or statewide HIE as well and go through that mechanism to connect with the EMR systems.
Yeah. Hi, I have a question on that. This is Cynthia. When you say connect to the EHR, what does that come through? Is it just a PDF of the work that's coming in here, or does it actually filter into templates?
Go ahead.
That could later be utilized either for billing, because I think one of the biggest pains for my providers is to have a template uploaded, and then they have to open a whole bunch of different files to try to find what was last discussed or where the patient left off.
No, I think, you would want to see we have this, we don't have to do that way. To answer your question, there is a lot of ways we can integrate with them. If they need a summary of everything that happened to that particular patient or a client, yes, we can summarize and hand off, put it into a PDF one place, they can see that. Or if they need to do it discreetly, going into, okay, I did this service, that service. I think you want to go to the client portal, Matt, so they can see the track. So this is the web version of the client portal, which is the mobile app that these guys have. So here you can actually see, as you can do, whatever that happens, anything you assign to them, they can see. The point that I wanted to show you was show them the timeline. Yeah. So this one, basically, if that is what they want to see, they can actually see everything that happened to that client on all the things and associated information we can attach if that's what we need to do. So all this type of information we can share.
So but they would have to log into the system to be able to get that, or it would come in as a PDF.
We can do either. That's what Karen was asking. If they want to do an SSO, this is a single sign-on option where they can click a button, their system, they'll automatically connect us to this one. And that's one approach. Other approach is if we need to periodically push this to the provider so they get to see it or what happened to the social side. Yeah, it could be a PDF. They can see social side, right tab, they click on it, they get to see all of it. So multiple ways of sharing that information we could do. And
So
good question.
so the dreaded, you have to sign into my app in order to use it, you have
No.
addressed. That's where you started, right?
Yes.
Okay.
You don't need to, again, as I said, we even make it even simpler. Sometimes, as I said, all you have is an email is the way you need to do. If there is a way you can share, obviously with the you need to be an HIPAA compliance email thing, we'll give you a box, you can email it. We can even integrate you with the email process if that's what we need to do. So we can do that as well. And this is the one we talked about, SOS button at the end. As you can see, that is the one that they press this one. They get help wherever they are. They get help automatically. And they get a text message. Goes to a crisis center. All the process is already integrated. So this is how we engage clients. And they can see their history, any assessment you want them to fill out, they can fill it out on their own. So you can push educational materials, track it. There's a lot of this type of capabilities that we have. They can set up their appointments. They can keep track of the vitals. So lots of features for the client and patient. Any questions? We have, I know time is very short there. Again, a good question guys are asking.
Yeah, there's a cost question. We price this on the number of clients served and the number of users of the system. So that way we can be cost effective for a smaller group, and then the larger groups get volume discounts on that basis. So that's how we price the program.
Yeah. You want to show them the dashboards briefly. Again, as I said, there's a lot of this here. We have a very short time. We just wanted you to get a flavor of this. If you guys need independently, and Karen, if you want to let us know, we'll be glad to set up independent meeting, drill through all of these things, and you can do that as well. So go ahead.
Yeah, absolutely. So just to, again, kind of briefly go through the reporting, a lot of what we've done so far today has been involved in data capture, but is it enough to simply capture that data? Right? We want to be able to present that to your users in a way that is meaningful to them, to be able to improve the services that they offer, or maybe even to go back to a granting agency and get additional funding, right? So again, just as a demonstration here, we've got kind of 3 reports here that are done in a scorecard style. So one overall for the entire organization, one specific to any enrolled programs that we're doing, and then one specific to those community-based organizations. So again, just kind of briefly to go through these. The organization scorecard is kind of a high-level overview of how our organization is doing with our clients, right? So we can see our total numbers of clients, numbers of providers, number of programs that we're managing, who are the providers broken out by type, for all of the programs, what's our current client counts, all that type of stuff. Referrals that are made, how many were social, how many were medical, are we distributing educational materials? Client contacts is an interesting one. This is actually a list of all of the different contacts that have happened for individuals in your organization, right? So here's us calling Grace, us talking Grace. This is mostly flavored for Grace because she's our main demo client, but again, this would be for every client within the population there. So. And then below that, we have demographics breakdowns, right? So splits by gender, age group, race, zip code, neighborhood, again, just lots of different ways to kind of segment the data to say, hey, this particular zip code has a lot more clients than others. Maybe we need to focus more resources in that area, right? So that's overall the kind of the organizational one. The enrolled program is a bit more specific to those programs. So we can see some of the similar things we were seeing before, number of programs, but now we have things like total enrollment, people who are unenrolled, enrollment trends across time for those various programs. Maybe we can use this to see, hey, this job skills program is kind of suffering. It's got some decline in terms of clients. Maybe we need to focus more resources on that to bring that back up to speed, right? So, and then again, similar demographics breakdowns, but these are specific for that program, right? So for each program, who's enrolled by gender, by race, by age group. et cetera, et cetera.
Yeah, you can filter
So-
the whole thing by programs as well. So we have a lot of filters. Again, he's given you everything there. So you can just say, show me just the Boys and Girls Club. If you're interested, just choose one just for them. Choose the circles part, yeah, and take out the all. Yeah, then you can do that. Then it kind of goes and filters just that alone. So it allows you to just focus on a specific program, how it does, what it does, and what is the breakdown on that particular program. So it kind of goes into a lot of those information you're already collecting, just making it easy for you to do export on that one. Similarly, last one, I want to show briefly.
Absolutely.
This
So
is
this
the
one is all
referrals.
focused on, again, those agencies, right? So how are your referrals doing? What types of referrals are you making? Who are our providers that we're referring to? What are the types of services that we most typically provide referrals for? And again, who are the preferred people that we're using, that we're sending those referrals out to? What are the types of CBOs that we're reaching out to? Again, social versus medical referrals. And then finally, again, a stat split by demographics here.
It's just a kind of a sample. We can build as many as we need. It's once the data collection, we can do it all from the assessments. So it's a combination of it. So just want to let you know what we have is a very comprehensive ecosystem for a community-wide, well-being process platform. That's what this is. It addresses the integration, data integration issues related to that, client engagement, bringing the CBOs, all the stakeholders into the common platform, everybody looking at the same thing with entire privacy process consent. I don't know whether you need to briefly show that, in terms of restrictions, you want to show them briefly. Go choose one on the restriction side. Choose assessment, for example. So this is a kind of a control, who can access what type of thing, goes into the granular level of individual people, individual item, in addition to who can see the system. So that's the one, Karen, we initially talked about, goes to the org level, then role level, then the client level, then the object level. There's 4 levels of access on any one thing, on either to a individual user, roles, or any one of those. So anyway, just to give you that flavor of just about everything that we have seen over the years, we have solved this here in one platform. And that's the thing. It's not, I don't know how we are going to do. No, we have addressed it, communities. And that's why we are learning. This process is forever continued to change, improve, because we are addressing day-to-day problems with communities we serve.
Yeah. We want to thank you for this opportunity to present today. If we didn't answer your question, I put my email in the chat box, so feel free to send us your questions by email if we weren't able to address them today. But thanks again, Kyra and Sarah, for this opportunity. And David, thank you for introducing us to CodeThrive, because we think you got a wonderful model here that I think can be a model for the nation as far as how to do this.
Yeah, before we go, are there any other questions before we can, we will be glad to answer? Okay. As I said, we'll be more than happy to, as Sarah said, if there are things that you guys want to spend more time, Karen, we'll be more than happy to spend time with you, dig through whether it meets your Ojai thing there, it may give you some ideas at least, whether it, works or not, that's okay. But at least, you can get some ideas out of this, and we'll love to share our successes, our lessons learned. We love to share what we have done. These are not theoretical. We are very much down to earth, working day in, day out with these people. So we understand challenges. So we can definitely solve those for you. Okay.
Thank you all so much. I mean, just like round of applause. I really appreciate you taking the extra time. Thank you everyone for sticking with us a little late past the hour on a Friday morning. I'll be sure to share this recording. So anything you're like, wait, what did they say? We can go back and check, because there's a lot of good material in there today. And of course, if you have any, again, more questions come up later, reach out to myself, to Kira, or Richard put his email in the chat. So thank you all so much. Have a beautiful weekend. Stay safe.
Thank you. Thank you, guys. Thanks, everybody.
Thanks, everyone.
Thank you.